Dry eye, what do you do for dry eye?
Well, dry eye is an area of particular interest to me. I completed a cornea fellowship in large part because I was so interested in this area, and it's very, very common. And at first impression, many of us think that this is a fairly common problem, but it's actually pretty intricate, and there could be many different reasons that patients may suffer from dry eye. Perhaps their tears are evaporating too quickly, or perhaps they're just not making enough of the tears in the first place. And this can be from simply an age effect, whereas all of us get older, we tend to have more and more dry eyes, or it can be from other diseases, other processes, injuries to the eye. And many of these conditions can be treated slightly different. We're all aware that dry eyes are generally treated with artificial tears, and this is always the first line of treatment, and it works well for the majority of patients. However, we have many other exciting treatments available now, such as punctal plugs. And so this is a little diagram showing that we all have tear ducts in each eyelid that drain down into our nose, so that if our eyes start watering or crying, we'll notice that our eye runs. That's because our tears drain down there. We now have little plugs made of silicone, which are designed to fit in our tear ducts to close them, just like corking a bottle. And by doing this, this will keep our natural tears in our eye longer and keep our eye better lubricated and more comfortable. Not only will our eyes be more comfortable, but our vision is generally better when we have an appropriate amount of tears in our eye. There's also a new medication that has been on the market not long called Restasis, which is showing a lot of promise. It doesn't work for everybody, and it tends to take about 6 weeks of treatment before you really see a benefit from it. But in many patients with severe dry eye particularly, this represents one of the last remaining options to really help them. And we're starting to use that more and more, and we're finding that in many patients it can help them when they were almost out of options otherwise. Other simple things that patients can try that may help with this is simply using a humidifier in their room in the evening, particularly during the winter when we're running the furnace, the air dries out, and a little extra humidity in the air may be all it takes. Also, goggles or even wraparound glasses that help prevent our tears from evaporating have been shown to be beneficial in many of these patients. But like I said, even though it seems like a simple problem, it's many times much more complex. And if you notice that your eyes are red, irritated, poor vision, tearing, I would suggest you come in and see your eye doctor.